Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Criteria for primary treatment failure. We can say that there has been primary treatment failure if edema does not start to disappear by day 4, if edema does not start to disappear by day 4, or if edema persists after day 4, or if there is failure to regain appetite by day 4, or if there is failure to gain weight at a rate of 5 grams per kg per day by day 10. Secondary treatment failure. In primary treatment failure, if the patient cannot, the edema is not subsided by day 4, or if edema persists by day 4, or if there is failure to regain appetite by day 4, or if the baby cannot regain weight of around 5 grams per kg per day by day 10, then it is called as primary treatment failure. Then we also have criteria for secondary treatment failure. In secondary treatment failure, there is failure to gain weight at a rate of 5 grams per kg per day for 3 consecutive days. So in secondary treatment failure, there is failure to gain the weight at a weight of at 5 grams per kg per day by, yeah, and if the baby cannot gain weight by 5 grams per kg per day, then it is secondary treatment failure.
thank you and thank you for watching.